I'm going to start just by apologizing if I have to step away for a minute or two, because I may get an urgent phone call from work. So if that happens and I have to just take that phone call, I'll mute myself, deal with that. It shouldn't be more than a few minutes and come right back on to continue the questions.
Could you speak a little
He
louder?
can't hear you. You're muted. He muted you.
Can you hear me now?
That's better, thank you.
Better?
Better.
Do you want me to use the headset? Should I try it? The headset? Oh, it's worth it. Use it here. It's fine. I'll talk loud and I'll try to speak loud. Okay, so I think we're going to start. Hi, thank you all for coming. I decided to do this evening because obviously we've been getting a lot of questions and there's a lot of confusion or misinformation or, as we say in Hebrew, iva da'ut, unclear what to do with certain situations. And it's certainly a very dynamic situation and something we've not dealt with in probably a century to this magnitude of a pandemic. A lot of stress, and I thought, especially here where everything, all the hanchayot, all the updates are in Hebrew and all that stuff, it might be easier for the English-speaking community to just go through some of the common questions in English. Louder?
Louder, just talk louder.
Okay, I'll try to talk louder. So instead of doing a whole introduction into coronavirus or COVID-19 or I thought maybe we could just start with the question and answers that we got, and then sort of probably that will, obviously incorporate a lot of the information that I wanted to give over. So I'll start with the questions we got on the Google document that people sent in before this, and if obviously people can write in the chat any other questions, hopefully we'll be able to get to it. So the first question, if I have a runny nose and I'm coughing and have had a sore throat but no fever, but I'm feeling fine, do I need to go into bidud or get tested? Bidud means isolation. So do I need to be isolated and get tested? So I guess we'll start with what does it mean? Who needs to be in isolation? What are the requirements for isolation? The requirements for isolation are pretty specific, and they are: one, anyone who has returned from outside of Israel. Sorry, anyone who's been returned from outside of Israel in the last 14 days from anywhere in the world. Now, that was changed to March 9th. So initially, we were starting country by country. And now we know anyone who's come from anywhere in the world from March 9th, 14 days has to go in the past has to go into isolation. Another reason to have to go into isolation is if you were in contact with someone who was positive. So if you had someone had a positive test, and that's why the Ministry of Health is putting out all the itinerary of everyone who's been positive, and the epidemiologists there are working very, very hard to go through their exact locations and where they were, because they want to, obviously it's a huge amount of work, and they want to track everyone down who could have had an exposure. So that's the other reason to go into isolation. So the main reasons for isolation again are any travel for the last you've come back from anywhere outside of Israel in the last 14 days. Or if you've been in contact with someone who is a known positive. That's not a reason to get tested. That's a reason to go into isolation. People are a bit confused everywhere in the medical community as well, because the other directive from the Ministry of Health was that everyone with a cough and cold, even if they don't fit any of these things, should be isolated. That's not the same form of isolation. They're not saying you need to be isolated because you're a suspected corona, but they're trying to just limit the amount of people who are sick out there. So they're saying, if you are if you are, someone just have symptoms of a cold, it doesn't mean you need to get tested. And it doesn't mean, need to go into the full isolation protocol like we do with people who are suspected corona, but it means, stay home, don't go to work, don't go out. We don't want other people getting sick. There's enough going on that with the corona that we don't need, other illness going on. So there's sort of like the real isolation for people who are possibly, having contact or travel with people suspected corona. And there's this kind of other isolation, more to like, just if you're sick, stay home. But it's a different kind of isolation. And none of the people in this isolation need to get tested. There are other criteria for people to get tested. Who needs to get tested? Obviously, if you are in isolation for either of these reasons and you develop respiratory symptoms. It's not only respiratory symptoms, but it's also fever. Sorry, that was on me.
Keep going.
Okay, sure. So according to the Ministry of Health, symptoms would be a fever and or cough and or shortness of breath and or other upper respiratory symptoms, runny nose and stuff like that. I get a lot of questions about, is a headache or ear pain or just throat pain. And those aren't enough to be considered upper respiratory tract infection symptoms for people who are in isolation that now need to get tested. So it has to be really fever or cough and or, it's important, fever and or cough and or shortness of breath and or other upper respiratory symptoms. I hope that's clear. Okay, I'm going to move on to the next question. What should you do if you suspect someone in your household is showing signs of the virus? So again, that goes back to my last response that, if someone in your house has signs of an upper respiratory tract infection or the flu, and they don't fall into the category of someone suspected for corona, for example, they have not been outside of the country in the last 14 days, or they've not been in contact with someone who is a known positive, then you can just treat it like the normal cough, cold, and flu, and except stay home. They want everyone to stay home and isolate at home. I'm going to get into this now, but there's a later question, but I think it's good to talk about it now. There's a lot of confusion going on right now in the medical community because we have here in Israel the Kupat Cholim, or the HMOs for those of you who are in the States, or sort of like your family doctor for those of you in Canada who are watching, who I've been telling all these patients, if you have upper respiratory tract infections, don't come in. We don't want to see you. You can call your family doctor. We'll try to do telemedicine, but stay home and don't go to the doctor. And it's a bit problematic in a sense because for those of you who know, I work in Terem, which is an urgent care. And, it's kind of, I've seen people who come in and they just don't know what to do because, they said, I have an asthma attack. I called my family doctor. They said, well, if you have an asthma attack, don't come in. I'm going to address this more for people in Israel, but, call the Magen David Adom. Basically what's happening here, that if you are a suspected corona patient, you're supposed to call the Magen David Adom paramedics, and they come to the house, assess you, and either take the sample if you're stable and bring it to the lab and leave you at home isolation, or if they think you are sick and need to go to the hospital, they bring you in full protocol to the hospital. So patients who have just upper respiratory tract infection and otherwise are not suspected corona, their family doctors are telling them not to come in, but they could be missing things. I saw a patient on Thursday who had like a horrible asthma attack and was like, going in circles to finally get treatment. And, so if you are in that category here in Israel, and if you're having, if you're feeling fine, you have what you think is a cold or a little bit, a little worse, fever, shortness of breath, some cough, but you're okay. Runny nose, sore throat, that kind of stuff, probably a good idea to stay home. You don't want to be exposed, or you want to expose other people. But if you're, if you have asthma, if you have chest pain, if you're really short of breath, and even if your family doctor tells you not to come in and call Magen David Adom, you might call Magen David Adom, which happens to many people, and they say, well, you don't fall into the criteria of a rule-out corona, you're just sick, go call back your family doctor, and they get in this vicious circle. So we have a clear protocol at Terem that obviously we see these patients, the doctor wears a surgical mask, you wear a surgical mask as a patient if you need to, and we will treat you. So I think that's very important to know because, or pass on, because I see a lot of patients who are sort of like lost, in this circle of not being treated, when people can mistake their shortness of breath, they think, is a cold, and it could be an asthma attack, it could be congestive heart failure, it could be, even a heart attack. I've seen in the past people who just, come in with shortness of breath. You never know. So I think it's important that if you are someone experiencing these symptoms, they're a bit more worse than a common cold, and you're not sure what to do, and your kupa or your family doctor is telling you not to come in, and you've called MADA and they're not going to test you because you don't fall into the criteria, then that's a good reason to come into Terem, for example, or to be seen, but not just to let it go, because that could be dangerous. Is that good so far? I can't hear you. I just see thumbs, so I'm going to keep going. All right, excellent. Sorry, give me 1 second here. Thank you, Kenny. I see that. Okay. What is your best guess of how long these restrictions will last? Oh boy. Okay. I don't even know. These restrictions aren't over, and they're changing literally, sometimes by the day, sometimes by the hour. We're in contact with the Ministry of Health, Ministry of Health all the time. They're doing things in stages. Let me just say off the bat that I think they're doing an excellent job. They're stuck between a rock and a hard place. If they don't do enough, people will say, you let this thing get too far. If they do too much, then people say you're collapsing the economy and, all the other arguments. I think they're doing it in stages. Can't hear me? Can you hear me now, everyone? Sorry, I don't want to scream. I'll have to drink some tea for that. So I think they're doing a good job. They're doing it in stages, and they're doing their best. And I think they're actually have made the right decisions and have been sort of ahead of the curve when you compare ourselves to other countries. I think they've done an excellent job. How long will it take to get over? We're not even finished getting there yet. So it's hard to say. I think there will be further restrictions coming within a week from the murmurings going on in the community behind the scenes. And what we hear, there might even be a night curfew from 7 p.m. to 8 a.m. They're talking about. There are other stuff coming. Don't quote me on it. No one knows exactly. I don't think they even know. They're sort of meeting every day. The good estimate that we're talking about. I think we're probably talking anywhere between 2 and 4 months. People think it's going to be a lot shorter than that. With the kids in school, maybe that might be. People think after Pesach. Is it a possibility? It's possible. Highly unlikely. I think things will take longer than they expect. If you look at what's happening in China, they've been going on there probably from November, December, and they're just starting to ease restrictions now. Of course, that was different, the bigger numbers, and that happened earlier there, but I think you're looking at a good few months. Again, no one knows. No one knows. This is all a prediction. But again, this is like an educated guess from the whole, not just me. I'm not educated enough to make that guess, but in the community. Can you still hear me? Excellent. Thank you, Jenny. Okay. Here we go. Oh, this is the big one. All right. Can kids have sleepovers? What about play dates? Oh, dear Lord. As someone who has 5 kids at home, that is a good question with not a great answer. I think to answer that question, we have to understand what we're trying to do. And like the buzzword these days, everyone sees everywhere, is social isolation, right? The point of social isolation is to stop the rate of spread of the infection. To stop the infection completely is almost impossible. That's not going to happen. This thing is extremely contagious. It's going to spread. It's going to infect a lot of people. Another buzzword people might have heard, I'm not sure if you all heard, is called flattening the curve. Has anyone heard that? That's where Italy failed, for example. Right? In Italy, they didn't do any kind of social isolation. They let it go, and there was just an exponential rate in infection. It just went up so fast that it completely overwhelmed the system. We'll talk about it in another question, but the coronavirus affects much more population over age 70. and with risk factors, and they're just literally overwhelmed. I mean, there's not enough ICU beds, there's not enough hospital beds, and it all happened so fast that it was impossible to care for everybody. And there's horrible stories happening in Italy because they didn't isolate fast enough. So for example, I'm just throwing out a number. If you're going to have like 500,000 patients, for example, at the end, or 500,000 people infected, you want those 500,000 people to be over 3-4 months and not over 2 weeks. Because you can imagine, right? If about 8% of patients require some kind of higher care, admissions, ICUs, or a ventilator, or that kind of stuff, high level care. If that numbers happen over 2-3 weeks, the system is completely overwhelmed. If that number happens over 3-4 months, 4 or 5 months, you're able to cope with it. And so that's really the point of social isolation, is to make the curve that's going to go up really fast to make it flatten the curve, right? To make that happen over months instead of over weeks, that the system can deal with it. And that's everyone's fear. Of course, also by isolating yourself, we may decrease the number of people who have it, and especially not give it to the more elderly population, or the population are put more at risk. And so any kind of social isolation you can do is the best. Now kids, fortunately and unfortunately, but fortunately, they do very well with this. Unfortunately, they're very good vectors for it. So a lot of the kids can carry it. You just don't know they're carrying it. But kids can get infected with coronavirus easily. And they may have a cough or a cold or nothing. They could be totally asymptomatic with it, but they're excellent at transmitting it to everyone else. So, the point is to try to sort of keep the germs in your own family. So if you have your own family's germs, you're less likely to pass it on to other people. If you have a friend over and you're in close contact, or you have a bunch of friends over, a big group play date, then you're basically exposing yourself to all those families' germs and all those families' germs, and you're exponentially increasing the risk of getting it and passing it on to somebody. Now, that's sort of on one extreme. On the other extreme, we're saying, well, we're not at the point where we're doing complete social isolation, right? The buses are still working, and people are still going to Rami Levy and the Makolet, and we're not completely isolating ourselves. So there's the other level of recommendation that says, okay, if you're going to have a play date, so do your best to, I guess, try to decrease the chance of having an infection, or, for example, do it outside, or only one friend at a time, or that kind of stuff, But, kids are jumping on top of each other, and you know how it is. It's very difficult, especially with little kids. So it's a hard question to answer. There's no clear guidelines right now. But if you understand the goal of trying to decrease the rate of the infection, and kids are excellent vectors for this, then you understand why not having play dates is a very beneficial thing for the society. And if you're going to do it, to try to limit it as much as possible, as few friends as possible, outside if you can, but certainly to have a whole bunch of kids over, yeah, sure, washing your hands, absolutely. We'll get to washing your hands eventually, but washing your hands, that's one of the questions we'll get to. Mendel's is telling me to wash my hands. It's true, wash your hands. But so, I can't give you a yes or a no, but I can certainly say that the less, the better. And especially with little kids and multiple kids, it's just a very bad idea. Okay, does that answer the play date question? To a sense, the best as I can. Okay, I'm gonna keep reading here. Question from a combat soldier, finally on a weekend, a week-long day off. Can 4 seemingly healthy, symptom-free soldiers go on outdoor teal, sleep outdoors in sleeping bags, whatever, go on hikes outdoors, carry their own food, travel in a private car, not socialize with other humans? I guess only those 4 humans. For 2 days and 1 night, starting tomorrow. I told her she can only go with your permission. Sorry. Oh, thanks. That's a lot of pressure on that. Oh, okay. 4 people spending a lot of time together on the outside in a car, probably, unfortunately, I'm so sorry, whoever this is, not the best idea. They're actually recommending not more than one other person in a car with you, or as little as possible. Again, cars would be an excellent way to transmit the infection. Remember that Misrad Abriyut, the Ministry of Health here, is telling people to be a meter apart. And there's a reason for that. Even 2 meters apart. We know that, that's the safer distance, and anything less than that, you have a high chance of catching it from someone who might be infected. So I can imagine 4 teenagers in a car, unless they have a massively long limousine, aren't going to be able to be 2 meters apart from each other. And hanging out and all that stuff over 2 days. I'm so sorry. You deserve it. Thank you to our Chayalim, but I can't really recommend that, because it's just, I think in the car and all that stuff, not the best time for that, and a high risk of possible infection or exposure. Is that okay? Excellent. Okay. Here I have someone who sent a couple of questions. Okay. This question has come up a few times. Well, I see people panic, but I don't recall people panicking in this level during the swine flu. Everyone remember the swine flu? Is there any reason to panic more? Hold on, we have a technical issue. Not sure what that is.
She's screen sharing.
Someone's screen sharing?
Yeah, she turned it on.
Okay, good. There's a bunch of people in the waiting room. I see 19 people.
Oh, really?
All right, hold on. There's 19 people. They're still waiting to come in. Oh boy. All right, one moment. Mendel.
This way?
Oh.
It's all right. Participants admit all.
Oh, sorry.
Okay. Sorry for that.
And we're back. Okay. For those, I see 19 people just joined. Oh boy. Okay, welcome. We're sort of moving our way through the questions. We've touched up some really important ones, but I'll keep going on here. So this question was about panicking more now than compared to the swine flu. I don't really like the word panic, but being more cautious and all the restrictions. The swine flu and coronavirus or COVID-19, very different. There's a lot of epidemiological reasons for that, but simply, if you just look at the mortality rate. Everyone can still hear me?
Yeah, I can hear you.
Sorry. The swine flu was a influenza virus, just to say, whereas obviously corona is a coronavirus, which is a different family of viruses. Influenza is different for a few reasons. We've sort of been exposed to it, many different influenza varieties for longer. We have more built up immunity to it. There's a vaccine to it. The swine flu might have been a new one in a sense, but we still have some kind of, sort of built-in immunity to it. Whereas corona, this was a completely novel coronavirus that we've never seen before. That's why it's affecting people so differently. But we'll just leave you with the mortality rate, which I think is the biggest difference. The mortality overall from the swine flu was about 0.02% overall, and affected millions of people all over the world and killed a lot of people. But the mortality rate, if you look at the number who died from it versus the number who had it, the mortality rate was, again, 0.02% overall. I mean, the overall mortality rate in general for any influenza, even though people say the flu,
I don't know why.
everyone always says that the flu also kills a lot of people. Sure, it does, but the mortality rate for the flu was about 0.1% overall, or a little bit lower. When you compare to the coronavirus, we're talking about a magnitudes higher, where the mortality rate is probably, we don't even know yet exactly, but it seems to be somewhere likely between 2.5 to 4%. I'm pausing. Okay, sorry. So about 2.5 to 4%. So you're talking about that compared to 0.02%. So the mortality rate is magnitudes higher, which sort of, epidemiologically will make understand why it's so much more important to get it under control. Another reason is something called, the contagion coefficient, or how infectious it is. So how many people, if one person has the flu, for example, like they'll infect about one other person, or 1.15 or something like that. So let's say 1% to round it off. So one person who has the flu will infect about one other person, whereas one person who has coronavirus will infect somewhere between 2.5 and 3 other people, 3 times more. And when you're looking at an exponential rate, of mathematics, which is horrible math, but that's a huge difference in how fast and how contagious it is. And those are the main reasons why it's so much more important, and there's so many more restrictions. And I like the word panicking by why we're being so much more careful with this virus compared to a flu virus or compared to the swine flu. All good? Okay, I'm gonna move on here. Prevention. Everyone says washing hands is important. However, I think your immune system needs to be prepared as well. What should we or shouldn't we do? For example, what type of food, how many hours of sleep, exercising, vitamins should we be doing? Alcohol with a winky face. I'll probably almost never say no to alcohol, but when it comes to what else we could be doing for our immune system, I mean, staying healthy is always good. Moving is always good. But I can't say that there's any sort of food, or there's no recommendation about, for example, people ask about vitamin C or garlic or all that kind of stuff. And none of that's been proven. I mean, there's all these people out there saying all these kind of, interesting things, but there is absolutely no evidence to say that any kind of food or vitamin or anything makes it better. And people are asking about resting or being active. I think just living a normal life. I mean, being healthy in general is good. Always being active and always trying to get sleep. I'm not the right person to talk to about that, at the sleep, at least right now. But no. Sorry, I'm just reading this here about home remedies. There's really nothing. There's really nothing proven to help fight this thing. And there's no vaccine yet, which is another reason we're trying to be so careful with the social isolation and all the preventative measures that the Ministry of Health are taking, because there's really no other way to fight. Okay? Okay, thank you, Mo. Moving along.
I have questions on chat also.
Yeah, I see. I'm trying to.
Go ahead.
How are we doing with time? 9 o'clock. All right. I am not in quarantine. However, I have very low immunity. If I need to go out, how do I protect myself? The paper masks are not reliable. True. The surgical masks, I get a lot of questions about that. Should I be wearing a surgical mask? You see all over the internet, millions of people wearing surgical masks all over the place. Surgical masks are for people who are sneezing and coughing, and because they help prevent some of the droplets from spraying everywhere. But the actual size of the virus is smaller than can get right through the surgical mask. So you're preventing the major spread from the droplets, but it's not protecting you really. So all these people walking around with surgical masks, it's relatively useless. If you're someone with low immunity, try to go out as little as possible, really. I mean, there's no other, I can't tell you much else. Is, as best as you can, stay home, isolate yourself. If you need to go out, wash your hands. Try to go out where the places where there's little, few people, smallest crowds, that kind of thing. But certainly wearing a surgical mask, if you're healthy and you're not sneezing and coughing, isn't going to help you. So the surgical mask is really if you're sneezing and coughing to help other people, but not so much to help you. It doesn't really help you. Washing hands, of course, every time you come into the house, every time, whatever, any time you've been out, whatever, washing your hands and touching your face as little as possible when you're out. Those are all much more important than wearing a surgical mask. Okay, I'm taking 1 second here. Sorry, I have to look at my phone because it's from work. Give me 2 seconds, I'm sorry. Okay, I'm gonna keep going to my question. My husband flew abroad this morning. He returns tonight, the same day. As I understood, he will be in quarantine for 14 days. That is true. What about me and the other family members? Should we be isolated too? Well, that's a very, very common question I get. What do the other family members do when someone's in isolation? So there's very clear directives from the Ministry of Health what to do. You do not have to go into isolation. If the isolation is done properly, there are no restrictions on the other family members. The other family members can go completely live their normal life as long as the quarantine criteria, isolation criteria are met. And I won't go through them all because there's a whole list of directives that could easily be found in English on the Ministry of Health website. But basically just, the person has to be in their own room with ventilation if possible, use their own bathroom if possible. If not, they have to, every time they go to the bathroom, put on a surgical mask, wipe everything down when they're finished, and that kind of thing. But again, I won't go through all the indications, but they're all there on the Ministry of Health website. But again, if you are following the Ministry of Health directives, there are no restrictions on the rest of the family for someone who's in isolation. Okay? Okay. Oh, Mendel's taking care of a link there. There's another one about play dates. What are the guidelines for playgrounds on the yeshuv? Okay, that's a good one. Being outside is better than being inside. Not touching equipment is better than touching it. So it's great to be outside and play with the kids, but I would try to keep them away from touching, public swings and slides and all that other stuff where a lot of other children have touched, because that goes to how long the virus can survive on a surface. And there's no clear answer to that yet, but it's definitely somewhere in the range of 9 hours to days. So we definitely are not recommending kids to play on playground equipment. Good luck with that here in Israel, but that's sort of the recommendation that's going out. Okay. Is fever an absolute sign of corona as well as coughing? Can coughing alone be a sign? Okay, again, I'll just go back to that because I think it's important to mention for all the people who joined a little late, just to go over the criteria. The criteria for coronavirus are A, someone who was supposed to be in isolation who now have symptoms. Someone who was supposed to be in isolation who has symptoms. So again, you're talking about, or someone who now has symptoms who was in contact with a known positive. And again, those symptoms are fever and or cough and or shortness of breath and or signs of an upper respiratory syndrome, like runny nose and that kind of thing. Sore throat itself is not, headache itself is not, ear pain is not, but it doesn't have to be a cough or shortness of breath. Even fever itself would be enough if you fall into that criteria. Okay, again, the criteria, again, I think it's important to differentiate that. The criteria is you are someone who is supposed to be isolated and now you have respiratory symptoms, or you're someone who was in contact with a known positive and now have respiratory symptoms. Okay, who needs to be, again, just for people who came in late, who needs to be isolated? And you've come back from anywhere in the world by travel in the last 14 days, you need to go into isolation. Or if you were anywhere near someone who's a known positive. And that the Ministry of Health is always giving out those information all the time. Okay, is that good so far?
Question about email.
Oh, yeah, sorry, go ahead. Maybe I'll just do one in Hebrew. I'm going to do one in Hebrew and I'll translate it into English. So the question in Hebrew was, Ma haramat hasikun lesovlei asthma, which in English means, what's the level of risk for someone who has asthma? I'm going to answer that in Hebrew. אסתמה הוא כן אחד מהגורמי סיכון, יש כמה גורמי סיכון, נעבור להם, אחד זה סרטן פעיל, זה אומר שאו בסרטן עכשיו או באמצע טיפול לסרטן, לחץ דם גבוה, רקע קרדיאלי, אז מישהו שעבר צנתור, התקף או מעקפים, כל בעיה בדרכי נשימה, כמו COPD, ברונכית כרוני, אסתמה, כאלה, וסוכרת. זה הדברים, הגורמי סיכון הכי חשובים. Translate for people who don't speak Hebrew, what I said was the biggest past medical history risk factors include any kind of cancer in the past, active cancer, or cancer being treated with chemo or radiotherapy, high blood pressure, any kind of coronary artery disease. If you went through a cabbage or you went through a stent or anything like that, diabetes, I mentioned that, high blood pressure, yeah, those are the main ones. And of course, if you have any kind of immunosuppression, so anyone who's taking chronic steroids and stuff like that, or taking medications for Crohn's or colitis, like Remicade, for example, those kind of medications. So I said in Hebrew because I forgot that. גם עוד גורמי סיכון זה בעיה במערכת החיסון, כמו אנשים שמקבלים סטרואידים, או מקבלים טיפולים כמו רמיקייד למחלת קרונס או דברים כאלה.
Question here
Yeah.
on email. Regarding travel home from the U.S. for Israeli citizens, is a shutdown planned? When?
Mhm.
I know about self-isolation. Okay, right. So if you know anything about
Okay.
shutdown.
So I haven't heard of any shutdown for Israeli citizens. Of course, now we're in a complete shutdown for anyone who's not an Israeli citizen, basically, or they're trying to, but especially from the list of countries. But if you're an Israeli citizen, I have not heard of any planned shutdown. I think most countries let their citizens back home. Could it get to that stage? Anything is possible. But I haven't had any murmurings of them closing the airspace to Israeli citizens at this point. Yeah. Okay. Let me speak a few more here. Well, this is a question about Britain. Hi, David. Thanks for doing this. Britain is dealing with corona differently from Israel. Anyone know what's happening in England? They're adopted a strategy to build up herd immunity by allowing a number of infections to increase significantly. It kind of reminds me of like, what do they call that? Those like chicken pox parties, or like, like everyone get infected basically with that. This seems both counterintuitive and contrary to the strategies adopted elsewhere, especially in Israel. Is there any medical opinion? There are some medical opinions that think this is a good thing to do. They're quite controversial. And I think most of the medical community think this is not the best idea in the world. I just looked at the stats today. Britain has about 1,400 patients and about 36 people have died. It's not the best mortality rate, so I'm not sure what their thinking is, but I would say the majority of the medical community think this is very controversial and not a good idea. Okay. Let's say your son is currently, another question, sorry. Let's say your son is currently in the Philippines and planning on visiting Canada for 2 weeks. It's always good to visit Canada, but not now, before returning home to Israel. Is that a really bad idea? And should they return to Israel ASAP? Even if they would like to visit Canada, which in general I would highly recommend, I probably would not recommend that now because Canada is also likely going to put you in isolation and going to shut their airspace eventually. They're not there yet. It's causing a lot of controversy in Canada as well. I'm following, of course, all the information there. But they've definitely now adopted more Israeli-like when it comes to the medical community, and people need to self-isolate a lot. I would think that's not a good idea at this point. Any travel increases your risk, and if they're Israeli citizen, come home. Going to be in isolation for 14 days, but you might be in isolation 14 days in Canada as well. And will Israel close its airspace to its citizens? Likely not, but you don't know for sure. So I would say not the best idea. Any kind of non-essential travel at this point would be frowned upon. Again, for the play dates and sleepovers, I know, we answered that already. Here's a really important question that I get a lot. What do you do if you're in the same space as Bob? I think Bob is like an actual person who was in the same space in Rami Levy. I see. Okay. What do you do? Here we go. If you were in contact with someone, let's say person A, and person A was in contact with person B in Rami Levy, who was next to someone who was positive. So you're asking me is someone who had to go into isolation, right? I was in Rami Levy, and then later I found out that next to me in Rami Levy was one of the patients, and now they were positive. Now, but you were in contact with me for the last 3 days. Do you also have to go into isolation? So it's important to say there's no what we call in Hebrew ma'agal sheni. There's no secondary infection here. It's only the person who was directly in contact with the positive patient who has to go into isolation. Even if I was out there for like 3-4 days before I found out that I have to go into isolation and you were in contact with me and I'm asymptomatic, of course, then you do not have to go into isolation as well. There's no secondary circle. It's only the person who is in direct contact with the person who is positive. And to be honest, that's a question that I get all the time from physicians as well. You know, that people all the time come in and say, I want to be tested because, you know, my wife was in that toy store while the guy was there, and now she's in isolation. What do I do? I want to get tested too. And no, there's no secondary isolation rules or quarantine rules. Okay. Realistically, how long is this expected to last? We've talked about that already. Unclear. I would guess somewhere between 2 and 4 months, but no one knows. Really, no one knows. Hold on. Message from the wife. I have to answer. Try to get to some of the questions on chat. They're good ones. Okay. How will we know when the virus is abating in Israel? What are the signs we will know that the national emergency aspect of the situation is no longer warranted? Well, number one, the Ministry of Health will for sure tell us, and they're doing a great job at being totally proactive about it. And number two, it really all depends on where you are in the curve. So when the number of new cases starts falling, as opposed to rising, which is happening now, today we're in Israel, we are at 213, which is the latest count today. When that falls eventually, and then we'll know that we're out of it. I don't expect that, to be honest, for quite a few months. We can all hope I'm wrong, and I hope all the epidemiologists are wrong, but I think we're talking about months. Can pets get the virus? Can humans contact it from pets? If you have a pet bat, maybe. No, but no. So if you're talking about a dog or a cat, there's a big meme going out now about WHO letting the dogs out because they've proven that dogs can't get dogs cannot be infected. I believe not cats either. I haven't heard anything about cats being able to be infected by the coronavirus. So I think your pets are okay. Do you recommend going to a hospital clinic for a prior appointment not related to corona? I think that any non-essential medical appointments can be done either by telemedicine or pushed off. Obviously, if you have something important that needs to get tested or get treated, of course, do so. But anything that's not essential, better idea not to. Okay, so I think we've discussed all the important ones, or everything else seems to be ones I've already touched upon. About the masks we talked about. Hold on here. Cars, people want to know about touching the sidurim in shul or books in the library and all that stuff. As less as possible. Bring your own sitter. Bring your own stuff to shul if you still have shul, because we're not supposed to be more than 10 people about a meter apart.
This is the chat.
Oh, someone printed out the chat. Oh, thank you. Printed out the chat. Okay. Wash your hands all the time, and as much as you cannot touch, public reading material. Sorry, I'm pausing for a sec.
Go ahead.
Okay, we're back. The better. Okay. How come people who are living with someone who has corona aren't being tested? So people who are living with someone who has a positive test don't have to be tested unless they have symptoms. I mean, let's think about it. If you test them, let's say someone who has corona, you test them now, and they see they're negative, and then they could become positive in 2 days. Well, you're going to miss it. So it's not really, they can start it's called viral shedding. They can start shedding the virus later. So you can test them now and you can miss it. And the next day, all of a sudden they'll be positive. Depends when you test them. So we don't really test people unless they have a reason to be tested. For example, there are people who should be in bidud, people who should be isolated. They were in contact with a positive person, and now they have the upper respiratory, cough, shortness of breath, fever, all that kind of stuff. Sorry, Mendel's. Can I visit my grandchildren? I'm in good health. Okay, I'm going to leave that by an anonymous person who I just saw their name, I think. It depends on multiple things. There are different ages of grandparents. But, Janie, I see smiling. But but let's just talk about the risk factors again. If you are someone who has high blood pressure, coronary artery disease, diabetes, cancer in the past, immunosuppressed, or any of that stuff, probably not a good idea. Also, age is a very big risk factor, right? The highest risk is obviously mortality over age 80. Over age 80, the mortality goes up from, to about, I would say 15 to 18%, which is a huge number. Starting 70 to 80, get the exact numbers for you. I actually wrote them down here. Just want to, don't want to lie to anybody here. Too many numbers to keep in my head. There we go. By age. Okay, mortality 80 plus, like I said, about 15, 18%. Mortality between 70 and 80, about 8%. Between 60 and 69, about 3.5%. So again, you're about the average overall mortality for corona is sort of like if you're between the ages of 60 and 69. 3.5% is not insignificant. I would say that's a moderate risk. 50 to 59, about 1.3%, and under that, you're in the way under 1%, anything under age 50. I see some people, some good friends smiling there. KK, how you doing? So I think that depends on your overall risk factors, and it depends on your age, and then you can make an educated decision. And obviously they're compounded. If you're a young grandparent but have a few of those risk factors, then I would probably suggest not. Each risk factor increases by a certain amount. I don't go into it. Probably the biggest ones are like coronary artery disease, immunosuppression, diabetes, and respiratory issues are the big ones. But with coronary artery disease seeming to be the highest risk for that. So I hope that helps you make an educated decision. Okay.
920.
Sorry?
It's 920.
920. Okay, we're going. Someone asked again about the flu, the response, and again, how come we're doing many of these draconian measures? And again, I answered that earlier when it came to the fact of the mortality rates, where the flu infects a lot of people. The mortality rate overall is 0.1% overall, maybe a little less. Whereas you're here talking about a mortality of anywhere between 2 to possibly 5%, depending on how overwhelmed the country gets and the average age of population, as well as the contagion or infectious coefficient, which is much higher for COVID or for corona, which will infect one person can infect 3 people as opposed to about 1 to 1 for the flu. But it's really the mortality rates magnitudes higher and much faster, much more contagious, and that's what really overwhelms the system, and that's what leads to a higher mortality. Does infection incur immunity? I would think most likely we think so, but it's too early to tell exactly what's going on. So we're too early into this to know what's happening with that. Can people get reinfected? There's all these stories out of China, but it's unclear. It doesn't look like it. There's not a good enough evidence to answer that question, unfortunately. Most people who get infection get immunity in general, but I can't answer that 100%. Is that already? Is it wise to keep an appointment with a dermatologist? Again, if it's non-essential and you think you can wait a few months, probably better to do that. Lower risk, but again, someone has to check you. And again, the point is to try to be the social isolation as much as possible. People probably still going to these appointments and it's probably fine. But again, anything that's not essential, I would say best to wait. What needs to happen? Okay, we asked to answer that question already. What are the key symptoms and what are we meant to do at each stage of our symptoms? Again, if you're not someone who falls into the criteria for rule out corona patient, then you treat your symptoms like any other cough, cold, pneumonia, upper respiratory tract infection. You only need to start worrying about being tested if you were someone who met the criteria for isolation, right, which we talked about before. Travel, in the last 14 days, or being in contact with someone who's a known positive. Okay, not being in contact. Again, I'm going to reiterate that because it's important. Not being in contact with someone who's in isolation. If someone's in isolation preventatively and they feel fine, and you were in contact with them for 3 days every day until they went into isolation, but they're feeling fine, you don't have to worry. You don't have to go into isolation. You don't have to be tested. Tobes, I see you there. Okay. Sorry, I'm looking for any more.
Second to last question may not be there.
If you are in bidud, can you go for a walk if you stay away from everyone? If you are in bidud again, for those of you who don't speak Hebrew, is quarantine or isolation, no, you should not be going for a walk. I mean, if you are in bidud, you need to be in your house. According to I think, Mendel, you posted the indications or the directives for in your house, in a room with ventilation, coming out as little as possible. And just heads up, because people keep asking me about this, that it is now a criminal offense to break your isolation. If you do, you could be fined 5,000 shekels and have a criminal record and up to X number of years in prison. And if whoever watched Bibi Netanyahu's speech the other night, they're going to start using more radical technologies to track us. So that might be also draconian, but they are going to use military technology to track people to see where they've been, and also if they're breaking isolation. So I would personally not play with that at all. Okay. How many days the symptoms of having corona show up? How many days the symptoms of having corona show up after being exposed? That's a good question. The reason we have isolation for 14 days is because it can show up anywhere up to 14 days. If you're after 14 days, you're all right. It seems to be the average is about 5 to 7. I think about 5 is the average, but it could be up to 14 days. You want me to keep going? I'm okay. I'm just going to take 1 second to look at my phone for a sec for work. I'll be right back. Sorry. Thank you.
Not all the questions that are printed out
Okay.
appear on the screen. So there are questions. I printed this out most of the way through.
There's some questions more. I still got more haircut. Okay, let's go back here. So all right. Does the restriction of being together with less than 10 people also apply to family members? To your immediate family members, no. To your immediate family members. So, there are some families here with more than 10 people, and yeah, no, you don't have to kick one of your kids out of the house if you're a big family. Fortunately or unfortunately. What if you're planning a large Passover Seder for only family with no one in bidud or no symptoms? Is there any way to restrict that? Well, I mean, if again, that family means immediate family, but this is not the time, unfortunately, at this stage, to be inviting multiple family members over for a Seder. Not a good idea, unfortunately. I know it's sad, but it's the truth. And it's the safest thing to do is not to, again, cousins, uncles, aunts, grandparents, whatever, brothers, sisters are not, immediate family. When I say immediate family, I don't mean it in the sense of like, your immediate family tree, but I mean people who are living in your home. Okay. Sorry. Your thoughts on a family. Your thoughts on a family living in the same house and always spending their time together, taking a Yule hike in nature for a couple of hours. Thanks. I personally plan on doing that tomorrow. That's okay. You're doing that with your family members in the same house, and you're out in nature. Again, I think the Parks Authority here are trying to limit the amount of people to try to keep the numbers the way there should be. Try to keep your distance. Again, 1 meter to 2 meters, 2 meters best. That's probably maybe easy at some point, hopefully, on hikes, easier than other places. So yes, for now, we are not on full home isolation. Hopefully we won't get to that point. So yes, still go outside, go for a walk, go for a bike ride, go for a hike, get out there. It's great. We live in a Tekoa, Yeshuv, where one of the rabbis was diagnosed with corona and is, thank God, recovering. Even though we haven't had direct contact with him, it's a small place. Are you saying that if we have symptoms, we won't be able to be tested because we didn't have direct contact? That would be correct. According to the directives of the Ministry of Health, Tekoa is not such a small place. But yeah, it's all relative, I guess. But no, so there would not be a reason to be tested, and even if you try to be tested, they wouldn't test you because you don't meet the criteria. Sorry, give me 1 second. Okay. My parents are in their 80s in New York. Would my traveling to visit them be more of a help to them at this point, or am I a greater threat to them by my visit? I would say probably not a good idea, especially over their 80s. That's the highest risk group here. You're talking about 18%, up to 18% mortality rate, which is a very big number. And travel is one of the biggest risk factors for contracting it. So at this point, I would say try to get, if there's anyone else who could take care of them closer, I don't know, but don't. I would not recommend that, unfortunately. I'm sorry. I'm saying I'm sorry. I'm a lot, and I'm Canadian, but I'm sorry. Okay, that's the Mendel.
So there's more.
There's more. Okay, let me look down here. Sorry.
Is Israel planning to encourage more testing since many people without symptoms are needed infectious and should be in Bidud?
Good question. Is Israel want to do more testing? Because, right, there's a lot of what they call asymptomatic carriers, people who have at this point, they have not changed those directives. But again, they change directives literally sometimes every 8, 12, 24 hours, which is all I've been doing for the last 2 months. So we are on top of it. And as soon as they change, we'll know. But for right now, the testing is remaining the same. There is murmurings of increasing the tests and increasing the criteria for who needs to be tests, but not in the, I haven't got that yet.
How can we shop more safely?
How can we shop more safely? Oh boy. Try to go at off hours. I know it's relatively almost impossible sometimes to shop more safely. Try to go to stores that have less people. Try to keep your distance. I wish I had a better, wash your hands after. I wish I had a better way, but
Before and after.
before, always.
What is the long-term plan? Are we just waiting for a vaccine at this point?
So the long-term plan, I think, is to do our best to socially isolate, and the social isolation, that's what we're doing, to again spread the number of people who have the disease over a longer period of time, so we don't overwhelm the system. Listen, I know it's like, hard to hear, but like at the end of the day, the number of people who get it probably won't change drastically. It might infect 60 to 70% of people in the world. Can we stop that? Probably not to a large degree, maybe a little bit. But what we can do is the people who are the most vulnerable, let this happen in over, again, 4 or 5 months and not over 3 weeks, like what happened in Italy, where the complete system got overwhelmed. And there's horrible stories of like doctors having to choose who goes on a ventilator, who doesn't go on a ventilator, because simply the healthcare system was completely overwhelmed. And I think Israel's doing a great job at doing that, at increasing measures slowly but surely, but they did it quite early on, and in a way that lets the higher level care in hospitals, the ICUs and wards, have enough beds and have enough resources and to take care of these patients. So yeah.
In open air, do you need to give a 2-meter distance?
In open air, yes. Even in open air, best to keep a 2-meter distance, because if you ever see, the Bibi Netanyahu loves that little like graph of someone coughing or sneezing and it sprays all over the place. Yeah.
How long does the virus last if you are infected?
That's a good question. People have been infected for a few weeks. They test you to make sure it's out. But people who have got the infection, it took them, everyone's different, but I've seen people up to under a month, usually a few weeks, 2-3 weeks.
What about attending a private gym in someone's home with max 4 people?
Attending a private gym in someone's home with max 4 people, that's not a great idea. I think that gym equipment is, again, crossing with different people. very difficult. Again, if it's like a huge space and everyone's washing it every single time and you have 2 meters within each person, but again, the turnover is very high there. But most, most gyms have closed for that reason. But, people are still, doing it with caution. There are still people holding some kind of classes. But again, in big spaces where they're washing the equipment before and after, and where you're able, certainly like classes where, they would be packed with 20, 30 people are now limited. Again, you can only limit yourself to 10 people, but it's more, almost as important as the 10 people or less is the space between. So if you have like 3 people crammed into a small room, it's not a good idea.
Research in France has shown that people should supposedly refrain from using ibuprofen because in the event that they have COVID, it is shown to worsen symptoms and outcomes. Any idea if this is true?
That's an excellent question, and one the studies are just coming out. So it's really a hot topic now, or it's not just ibuprofen, but we call the NSAIDs, or the non-steroidal anti-inflammatory drugs, Advil, naproxen, and all that type of medications. And there is some evidence that seems to be just coming out that shows that this could worsen things. Some has some kind of negative effect. Again, it's super early on, but it does seem to be some indication. There is some slight truth to it, but again, there's not tons of evidence. So people are recommending now that people who have cold or cough or respiratory fever symptoms, better to use acetaminophen or Acamol in Israel or Tylenol in Canada or the States, as opposed to using Advil or the ibuprofen or that kind of drug.
Please repeat the question after I say it. Will the warmer weather help anything?
Will the warmer weather help? That's an excellent question. Everyone hopes. The warmer weather did help with other coronaviruses. For example, the last one being SARS. I know people remember SARS was a big one. Again, numbers were much smaller and different, but at the end, sort of withered out. And that was during the warmer weather. We don't know. There's epidemiological modeling that shows that might not be the case here, and don't expect that here. And this thing might just have to work its way through the population. We don't know. But there's always that possibility that the warm weather will make things better. Again, there's more people outside and less coughing and all that kind of stuff. Transmission might go down. We hope. It's happened before. No one can tell you, unfortunately.
Okay, one more question here. When infected, does that not necessarily mean hospitalization? You can be infected and heal at home as well?
That's an excellent question. They asked about if you're infected, if someone is infected with the virus, if someone is positive for corona, do they need to go be admitted? Initially, we were admitting everyone to hospital who was positive with corona. Some people now we see are doing quite well. People have corona, but they have mild symptoms, even if they're positive, and they're stable. And so again, we don't want to, which is very important, not to overwhelm the systems here. So we're moving now, starting really this week, or the last few days, maybe just starting to more home admissions, where we will be sending these patients home, and they'll be monitored very closely by their HMO or Kupat Cholim, being called, a lot of telemedicine, and being checked up on every few hours. And there's a whole system now in place to monitor these patients at home, to allow the sicker patients to be hospitalized as needed. Unless there's looking at anything else here. Any other, did I hit on all the important topics, everyone? Anything pressing that I missed?
We're going to make this session available, this recording available. We'll post it on the same LNO Facebook link or thread that David started on behalf of myself and all the attendees. Thank you, David Zlotnick, for all your time and effort. And it's very, very informative.
Thank you, Mendel, for setting this up. I could not have done anything close to this without you, so thank you.
All right. Have a good night, everyone. Stay healthy. Stay inside. Stay home. Don't go out if you don't have to.
Wash your hands.
Wash your hands. Bye.
Bye. Good night.
You're not sick, are you?
No.
I'm good.